What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, March 2nd, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a threat to you. Let's face it, there's a lot of viruses that are spreading right now, and they are a threat to your health. If you want to stay informed on this, hit that subscribe button down below. If you like the content you see here, by all means give this a thumbs up. If you want to see more content like this, by all means share this with anyone you know. Today we're going to start off with a few news stories, then we're going to take a look at some data, including wastewater data, and we're going to also take a look at a couple of states today that we have not looked at in quite some time. First off, we have to start off in Winnipeg, Canada, because, well, there's a children's hospital that is being pushed to the limit by respiratory viruses. The Children's Hospital Intensive Care Unit is overflowing, and nearly all inpatient beds are full owing to a surge of respiratory viruses. Let's read a little more here that I have highlighted. As of 12:10 a.m. Friday, there were 21 children in the pediatric ICU, the majority of whom have significant symptoms consistent with influenza, RSV, COVID-19, said Shared Health. The baseline pediatric ICU capacity is just 12. And here they're having 21 people in the ICU. That is totally ridiculous. Let's keep with Canada, shall we? There's more news out of Canada. Measles may be spreading in some Canadian communities, officials warn. So this is really interesting. Why is this interesting? Well, because the country now has at least 9 confirmed infections for 2024, according to a CBC News count. A 2-month tally that's not far off of the dozens cases reported for all of 2023. That's right. There were just a dozen cases reported for all of 2023, and now they already have 9 this year. Coming down even further, this is not good at all. 2 recent cases identified in Quebec and Ontario were not tied to prior travel and did not come in contact with any known measles cases, suggesting that individuals may have been infected within their communities. So that's suggesting, you know what, it could already be spreading within the community. If you want to read more about this, I did tweet this on my Twitter account at COVID Data Report. All right, continuing on now, we have to talk about Florida. Florida has a continuing growing measles issue. At this point, I can honestly say I've lost count of how many cases there are now, because there's all these various different reports of cases, and Orlando Health now confirms 4 measles cases, but there's no local spread. State officials say, I don't know if I believe that or not, but it says Orlando Health has seen 4 confirmed measles cases as its Central Florida emergency departments within the past month, the hospital system says, but state officials say there is no outbreak in the Orlando area. 1 case was in an adult, and 3 were in children less than 2 years old. I'll continue to do research this weekend, and maybe early next week in the pandemic update, we'll talk about just what the actual tally is for Florida, because it definitely seems to be increasing, and it does say down here, it says in total, the state health department is reporting 10 Florida measles cases in 2024. But again, I don't know if I'm buying that. I think the number is probably likely higher at this point. There's probably a lot of people that aren't even bothering to get tested, or noticing, oh, it's just something else, it's no big deal. You know how it goes. It's happening everywhere with COVID, and I'm assuming it's probably going to happen with measles, because everyone is just so laid back about the spread of illness. Speaking about being laid back, we have to talk about this. Do you feel safe working in person in an office right now? So we put this out at 9:25 this morning, this poll. There's been 802 votes already. It's at 92.1% say no, they don't feel safe working in an office right now, and 7.9% just said yes. And that's just a mere 7.9%. The majority of people do not feel safe going back to in-person in the office. And then we come to my city, Philadelphia. It says, in Office work rebounds as Philadelphia eyes in-person work mandates. Mayor Sherelle Parker, that's our new mayor, eventually wants all 25,000 city employees called back into the office, but has yet to lay out a timeline. She's also talking about she wants all other employers that still have people that work from home to return to the office. Now, there's several different reasons why I don't think this is a good idea, and some which are not COVID related. We do have a safety issue. We do have issues with our mass transit system as well. I mean, on and on the list goes, but we're here talking about all the viruses right now, specifically COVID. And if we continue to go on down here, I want you to read this. I want a thriving downtown. I want to see more people walking in, frankly, going in and out of our stores and spending money, helping to strengthen our economy, said Parker last week. While that all is a great idea, pre-pandemic times, that would be fantastic to see the city vibrant, any downtown city in the United States, vibrant with an economy. We're still in the pandemic. The pandemic did not end, and this is going hand in hand with the CDC guideline change yesterday, because it's just more proof that they're changing the guidelines to make it easier for the economy to thrive. While it is important for the economy to thrive, guess what? If people aren't healthy, if people aren't safe and healthy, guess what? When you're disabled and sick, guess what happens? People aren't going to go out to the stores, businesses, restaurants, whatever, because they're disabled. They're sick. They're not healthy enough to do so. And ultimately, by us just letting this rip, letting it spread, we're really, in the long term, going to hurt the economy. We're only in 2024. COVID-19 originated in late 2019 and really became a thing in 2020. And here's the deal. We don't know what the long-term impact of multiple infections is going to be. We may think we know what it's going to be, but we really don't know. What's the economy going to look like 10 years from now as we continue to let this spread, continue to let this mutate, continue to allow people to have weakened immune systems where they get sickened by other viruses much more frequently? How many disabled people are there going to be? Is it going to be to the point that the viruses cripple the economy on their own? It could happen. I get it. People want everything to go back to normal. But let's be real. Things are not normal right now. I'm constantly seeing people who are sick, who have gotten sick before the vaccine. I always get the argument thrown out there. Well, the majority of the people that we know sick are the vaccinated. Come on, give it a rest. Long COVID, weakened immune systems. They started before the vaccine came around in 2021. They started the day COVID started. The day people started getting infected in 2020, people started getting weakened immune systems and things started becoming, more not normal. Okay? All right, moving on now. Let's take a look at today's air quality values across the United States. And you will see that across the United States, air quality is not too bad, but then you come to this central region. You come to the Great Lakes, and a lot of that is a product of what's going on. We have wildfires in Texas, which are continuing to get worse. I think I'm going to be doing a piece on that on my other channel, probably at some point in the near future. Taking a look here. Here is my other channel. It's Climate Data Report. We haven't done that in a while. It's hard to run two channels. I want to keep this current channel going daily. I wanted to do the other one daily, but I think what we're going to do is just a couple videos a week on the other channel. That's the best way to do it. So Climate Data Report, if you want to subscribe to that, there'll be a link for it down below. All right, let's look at some data now. 791 EMS calls in Philadelphia yesterday. That was up ever so slightly. Let's do a live look in at the Philadelphia suburbs, and you can see here that there are 10 calls right now in Montgomery County, one of them being respiratory emergency, another one for vomiting, and a whole bunch of head injuries or falls and vehicle accidents at this time. Whoa, not liking what I'm seeing here. This wasn't like this when I looked at this just 20 minutes ago. Take a look at Chester County, Pennsylvania. We see not 1, not 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 active calls right now. Someone correct me if I just counted that wrong, but very busy in Chester County. And why did I just count the calls? Something I never do. Because it's Saturday. I'm not used to seeing that many calls in Chester County on a Saturday. Okay, one of them is for labor, a couple of them for respiratory emergency. I'm seeing dead on arrival. I'm seeing sick person. I'm seeing heart problems. I'm seeing all types of falls here. This is not good. All types of calls, I should say, not falls. Although, yes, we do have that there as well. There's multiple fall calls at this time. So, yeah, this is not good to see Chester County so busy on a Saturday. All right, taking a look at Walgreens, and you can see here on Walgreens, positivity rate was down this week, 17.3%, but we're being very skeptic about that because so many states did not report. There's such a decrease in testing. But hey, the positivity is dropping. That's a good thing. Would it have dropped as much if more states were reporting? Honestly, I can't answer that question. All right, taking a look here at the latest data from wastewater, and we are going to take a look at some wastewater here because we're doing a different type of video tomorrow. I'll explain that when tomorrow comes. You'll be surprised. I think you are going to like it. Taking a look here, new sites there in white, and these blue sites, 0 to 19% is the darkest blue is the lowest one, and you can see here we do have a whole different bunch of shades here of blue, and then this real 40 to 59%, this real light shade of blue, that is the moderate color. Then it gets worse. Orange, 60 to 79%. That's moderate to high. And then really high is at 80 to 100%. That's just red. And there's still 130 sites that are in the red, 368 in the orange. And we would like to see more in the dark blue, but we don't at this point. I mean, it's gone up somewhat, but we need to see this go up a lot more. And we're just going to do a quick look around here, and you can see there's still a lot of red in the East Coast, red and orange from New York City on southward. I wish I could show you New York City, but they actually took away the sites from New York City. It's not coming up anymore. And you can see down in Houston, Texas, look at this, still red and orange. Dallas, Texas, still some red and orange. California, Northern California is doing worse than the southern half of the state. And then when we take a look at Washington State, you can see there are still some red and orange sites at this time. Oregon, a lot of blue, just one state in the orange at this time. Utah, still quite a bit of orange for you. And let's go over to Illinois. Look at this. Still quite a bit of orange. And how's the big site doing that has been red? Let's check on that. And yeah, Cook County. Wow, with this 1.1 million population, it continues to rise in Cook County. That is not good, and we must not forget about the southeast. What's going on down there? We can see Florida. There's still a lot of orange and red. Spring break's coming. I think you're either going to stay where you're at, maybe even rise a little bit, just because, remember, this is not all states are going to follow the national trend. Some states are going to go off and do their own thing. Florida could be one of them with spring break coming up. All right, we're taking a look at some more wastewater data now. BioBot, look at this. A really nice drop now in COVID wastewater from BioBot. This is good to see, and we're also seeing here with the Northeast region, big drop. The South region, also seeing a big drop. The West, somewhat of a drop, and just flat in the Midwest. And I think part of that could be what's happening in the Chicago area. If Chicago area was not rising, I think that would have dropped a little bit. And the Southeast, we'll have to see if that remains. Florida could definitely skew that a little bit down the line, but we'll see. Maybe I'm wrong. Maybe Florida will not have a spring break wave. We'll just have to wait and see. All right, let's take a look at a few wastewater sites here on the wastewater scan. We're going to start off in the West Coast. I just had Sacramento up there. We looked at that the other day. Let's go to the southeast side of San Francisco and see what's going on there. And if you notice, by switching browsers, this site's actually moving a bit faster. That's some welcome news. 750,000 population here. COVID, it's low and dropping ever so slightly. RSV is medium, rising slightly. Influenza A is dropping. Influenza B was rising, but now look at this. Still high, but it's rapidly dropping. Again, I don't understand these calculations. You can see here the number of pathogens. It's not all that high. It's just five samples that show. I think that's how it works for these on here. And take a look at that. It's dropping, so that's a good thing. Mpox. There have been some detections of Mpox back in January and February, and even back in December. There's 3 detections total. And let's see, what else do we want to take a look at here? Norovirus. Norovirus has risen slightly, but now is starting to drop. All right, let's continue on here. Let's look at a couple more wastewater sites. How about Las Vegas? It's been a while since we've checked up on Las Vegas. Las Vegas, not doing bad. they're still dropping for COVID, slightly trying to rise for RSV. Influenza A is dropping. Influenza B is dropping. Again, it comes up high. We won't go through that debate again. And Mpox, there have been a few detections of Mpox at this time. And now let's go a bit more to the east. Let's check on our site in Arkansas that was having a big norovirus issue. Harrison, Arkansas. Let's see what's going on there. We see for COVID, it's dropping at this time. RSV, it did rise a little bit going into the end of February. It's trying to drop a little bit now starting in March. We'll have to see if that gets corrected. Influenza A, high but dropping. Influenza B is dropping ever so slightly. And again, some Mpox detections. I think this site may be having that issue where it's showing some detections all on the same date again. That's likely an error, so we won't take that seriously. And let's come down now to see what's going on in Atlanta area. Let's go down to the South River in Atlanta, Georgia, wastewater facility. We see, look at this, COVID. Some signs it may be trying to rise once again. RSV is low and flat. Influenza A is flat. Influenza B is rapidly rising once again. That's not good to see. HMPV, not much of an issue. And norovirus is starting to rise again. So that's something we'll have to watch. And look at that. Once again, some Mpox detections. They actually have 5 there compared to the previous site we looked at. All right, let's just do one more wastewater site. How about we come up here to, how about we come down to York, Maine? Remember they were starting to see a rise for COVID the last time we checked them out? Well, they did see that rise. Now they rapidly dropped for COVID. RSV, slightly rising, not much of an issue at this point. Influenza A is dropping. Influenza B is also, kind of doing its own thing. It dropped a little bit, now it rose a little bit. HMPV, not much of an issue. Norovirus continues to rise in York, Maine. And remember, this is not that big of a wastewater site, but they do see a lot of tourists in the summertime. So summertime's when we get more interested in this area because they probably see a higher number of people using the facilities, the restrooms, that causes wastewater in the summertime versus the wintertime. All right, moving on now to some CDC data. And you can see here the highest wastewater levels in the United States are in the southeast at this time, at least according to this page from the CDC. And you can see here these dark blues represent very high levels. And I got to remember to start showing these codes of these maps, the map keys more often. I don't. My apologies, but in this case, dark blue means very high. Let's go on to the next set of data from the CDC, and this actually did not update. National hospital capacity being used is at 76.6%. That's fairly high at this time. It's a lot of beds being used. And because of that, 2.3% is for COVID, 1.1% is for influenza. And how about ICU usage at this time? That is at 72.3%, 2.2% is for COVID, 1.3% is for influenza. Let's take a look at another bit of data. And we can see here that deaths here, for the most part, are dropping now. But there are still a few areas where it's rising. You can see here, this yellow here. Well, that would be a rise that is being shown up in Maine at this time. Taking a look at hospitalizations, 17,310 people in hospital. That's down 10.3%. And you can see here where we see these oranges and yellows. Those are areas that could still be seeing rises for, more so the oranges. Those are areas that are seeing rises in hospitalizations at this time. And correcting myself, the yellow is stable at this time, and the greens and the darker greens are moderate decreases and substantial decreases. And look at the state of Maine. There's quite a bit of an increase going on for hospitalizations. Don't know what that's all about, but hey, that's not good to see, and it looks like it's in the lesser populated region of Maine. Texas, there's some areas that are seeing hospital increases at this time. Kentucky, Ohio as well have some counties with increases. All right, continuing on here. Epidemic status. Only one area in the United States is seeing it likely growing for COVID, and that is Idaho. Everywhere else is stable, uncertain, likely declining or declining. Flu at this time? Yeah. Right across like the central portion of the United States, across the I-80 corridor, even further south there, across parts of the I-40 corridor, flu is once again growing or likely growing at this time. Taking a look at the variant proportions, we did get a variant update yesterday. JN.1 is at 92.3%, JN.1.13 is at 3.3%, JN.1.18 is now at 1.8%. 2 new variants. We'll have to keep an eye on them. All right, moving on now to the state of New Jersey and taking a look at New Jersey's hospitalizations. Yeah, look at this. This is relatively interesting. They had to correct their hospitalizations higher. It's now 536 people in the hospital. Yesterday, they were showing like 490 something. So, yeah, it did correct higher. Interesting. 25 people on a ventilator, only 67 out of 70 hospitals reported. So, this number is probably even higher than what it's showing. 85 discharges, and in the ICU, 63 people in the ICU. Good to see that number slowly going down. Taking a look now at New York State. New York State had 1,328 cases reported yesterday. Hospitalizations in New York State, and we do have to zoom this number in. It's probably going to refresh on us. Let's zoom this in and see what the number is, and we will see that in New York State, their hospitalizations continue their drop at this time, and it is 1,066 people in the hospital with 129 people in the ICU. We are now going to conclude with 3 more states, 2 we have not looked at in some time. This is California first, and everything in California, including COVID and influenza at this time, continues to drop. The positivity rate for flu is 5.7%, as is COVID as well. Wisconsin, surprise, we haven't looked at Wisconsin in a while, and we can see here, Wisconsin hospitalizations are dropping at this time, and as of the most recent update, they have, I believe they have just over, let's see here it is, they have just under 300 people in the hospital at this time, and that number continues to drop. Taking a look now at their hospital bed use as of the 24th of February, they have 74.4% of beds in use and 71.1% of ICU beds in use. And look at this. This number's actually been trending ever so slightly higher throughout the season. So that is not good to see. And there's that full number for the number of people hospitalized. It is at 237 for COVID at this time. So that number continues to drop nicely. And finally, we're going to take a look at Tennessee. We're just going to take a look at the chart here. And you can see here, Tennessee did have a rise in COVID cases back in February, but look what's happening as we are now heading into March. They are starting to drop, so that is a good thing. Alrighty, folks, I know this has been a long pandemic update, but there were a lot of things that we had to get through. We will have another pandemic update again tomorrow. Like I mentioned, it's going to be a little bit different. I think you're going to like what I'm going to do. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you want to share this with anyone, by all means, share this with everyone you know. And of course, always leave your comments down below. I love reading your comments. Alrighty, I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.